in psychology, we recognize two different environments, the outside environment and the inner environment. Outside environment is not in our hands, always changing. What is in our hands is only just the inner environment. Many times we're just breathing very unconsciously.
And this is a very common problem right now.
That when you exhale with the mouth, the heart rate goes quicker down. Our goal is to train the cells.
Can we say it is like we can program our mind through the breath?
The subconscious needs to go out. Sometimes the panic attacks and so on are helping us to release this kind of traumas what we have. But what I found the most important is the breathing. So in the critical situations, we forget to breathe. You need to do breathing. There is no another way how to do this. We need to understand that whatever we are creating, it stays somehow with the subconscious and it comes later on.
Hello, this is Dr. Sweta Adatia. Welcome to another interesting podcast episode from the Limitless Brain Lab. I am a neurologist and your brain coach. I'm sure that you would have gone through all our videos and podcasts and your life will be changing. That is the purpose at the lab. We want health, wealth, and happiness for all. Today, I have a very, very special guest. But before I tell you about the guest, I want you to give a poll. How many of you are using any of the watches, the Whoops or the rings, Apple, Samsungs, the health monitoring, all the devices which is giving you your data? Now, there's a lot of supply. You know all your heart rates and your heart rate variabilities and the sleep efficiencies and all the scores. But what do you do with it? What is the apply? How does it make you fit? How does it make you strong? How does it make you mentally better? How does your sleep improve? How do you use all those parameters in your daily life? So today, that's why I have somebody who is definitely going to change that for you, where you will very quickly understand how do you read your reports, particularly HRV, heart rate variability. Heart rate variability fundamentally looking like a very, very simple assessment, but has lots and lots of applications. And who better than an expert who was previously an athlete and a clinical psychologist who practices the use of HRV in his daily practice for years. He's originally from Slovakia and has been trained for over 11 years in United States. He's a board-certified HRV biofeedback therapist and has been involved into a lot of experiments related to HRV and also training people in HRV. The next time you look at the data, you are going to be a pro at reading those. So with that, welcome Dr. Martin Kramer. Thank you for coming to the show.
Thank you very much, Dr. Sweta. Appreciate to be coming here. So very happy to be part of this podcast.
Thank you. I was just reading the data, Dr. Kramer, and they say that some 2 million people are using all the Whoops and all the Aura rings, and so much of data is all around, right? So let's get to the basic of, in that particular, all the data that comes in, heart rate variability is sort of the king of the data, right? How do people make out what is HRV and how do you read it? In very, very basic, simple terms.
Yeah, so I'm going to try to explain, because there is a confusion between what is the heart rate and what is the HRV, right? So HRV is basically the natural rise and fall of the heart rate or pulses in response to our breathing, our thoughts, emotions, blood pressure, and also the homeostasis. In other words, the better we have the split between the highest point of the inhale and the lower point of the exhale, the better we have variability. Mm-hmm. So let's just say, what do you think? What is your heart rate? What is your average heart rate?
80.
80, all right? Now, if you have just normal watch without this HRV, then this normal watch just gives you the average, so 80. So that means, do we know if the heart rate 80 is good or bad?
No, it's just a number.
It's just a number. So we need to see how the heart rate goes, right? And that gives you only just the applications and the watches and any kind of systems now which covers this HRV. And basically that's what we need to see. how the heart rate goes. So because when we inhale, the heart rate goes up.
So when
When
I
we
take
exhale,
a deep
it
breath,
goes down.
when I take a deep breath, the heart rate will increase.
Yes.
And when
When
I'm
you exhale, the
exhale,
heart rate goes down.
So-
This is the most important thing, because if you have heart rate 80, and let's just say, I think it's not your case, but the heart rate would go to just 81 with your inhale and 79 with your exhale. That would be average 80, right?
Yes.
But that would be very bad variability, because you have only just 2 pulses difference between the inhale and exhale. But if your heart rate is 80, and you would have, with your inhale it goes to 90 and the exhale to 70, we would have 20 beeps difference, and that would be better.
So basically, we can just simplify it and say that it's the beat to beat variability between my heart rate in synchronization to my breathing.
Breathing and also thinking, because this is very much connected, yeah? Because many times we're just breathing very unconsciously. And that's also part of the treatments, that is unconscious breathing, we want to change this for the conscious breathing. So have these things more in control. Because in psychology, we recognize 2 different environments. And this is the outside environment and the inner environment. Yeah? But the outside environment is not in our hands, always changing and so on. So basically, what is in our hands
Yes.
is only just the inner environment.
Beautiful.
And that means, how we breathe, how we evaluate the situations, and how we are maintaining our positive, kind of like seeing the word positive attitude towards the life, and also in the way how we are integrated to the situations, because in some cases we need to have more sympathetic as the fire up, and some cases we need to know how to switch off. And usually the people have one of these, basically activities kind of like dominant. Yeah, so either they are very high in the sympathetic or in the parasympathetic. So in other words, we need to create the balance.
Right.
So
we'll
when
just-
we need to fire up, we're gonna fire up. When we need to relax, we know how to relax and switch off.
So we'll just explain that sympathetic is nothing but when you are ready to do something. It's like getting ready, It's like also involves, if it is extra, then it also involves being stressed and fight, flight, fear. And your parasympathetic is also the vagus nerve, which is rest and digest. So as he mentions beautifully, that there has to be a balance. I loved what you said off studio once, that your digestion is not in your control, your heartbeat you cannot change. The only one thing which you can change is breath. And how the breathing, as you rightly mentioned, is connected to your mind. So many patients come to me and say, Doc, I'm suffering from overthinking. And I strongly feel that it's not really the overthinking that we can do anything about immediately, but we can do something about the over-breathing. So tell us, in your experience, how do we get this data, the HRV data, and translate into helping people from this data?
Very good. So basically, let me just tell you that I've been working with this HRV measurements or diagnosis, for the last 17 years. I was introduced to these techniques by Dr. Karlstadt. He's actually the head of this American Psychological Institute in the US, and I was getting the certificate. And I was basically got certified as a American Board of Sports Psychology. That was in 2008, and the final projects we did in the Columbia University, as I was doing the kind of like measurements there. And since then, that was with the athletes in that time. So with the tennis players, Dr. Karlstadt is very good to measuring the tennis players, and he has lots of research. So you can really read these books from him, from the American Board of Sports Psychology. So since 2017, I was trying to apply these measurements also, in any kind of measurements, as we want to see, for example, anxiety and stress. Mm-hmm. When you're going to ask somebody like, how much anxiety you have, can we measure? Is there any data? So we can get the data from the questionnaires, right? But everybody's perception of the anxiety is different.
True.
So we need to have something like what we're going to see the stress, anxiety very objectively. And that's the HRV.
Right.
EEG doesn't show us the autonomic nervous system, and therefore only HRV is going to show us, the autonomic nervous system, and especially the two branches, the sympathetic and parasympathetic. And this is so important for us because the treatment for the sympathetic people is different than in the parasympathetic. What I see in the therapy, basically, if somebody doesn't know which basically is in the sympathetic or parasympathetic, if the dominance is more in one or another. If you, for example, like long distance running, or like long distance walking, this is going to be mostly in the parasympathetic. So your dominance is in the parasympathetic. And if you like the sprints and very high...
Quick, fast is going to be sympathetic.
Yeah, fast, quick, circle training and so on, right? This is what you like because the system allows you to do this. And this is going to be sympathetic. Without any kind of measurements you can see. I just brought some pictures here. Later we're going to put it to screen and so on. But to understand how it looks, now this will be example of very much, stress and anxiety. Yeah.
Because it is going all the curve. So let's make people understand that. Let's assume that this is one beat and this is the other beat, and this is what we are measuring in terms of the variability and the graph. So there are two things, right? So there is one which is the variability and the other one which is the coherence.
Yeah.
So this looks to be not so happy coherence.
Not so coherent. Yeah. But let me just explain because we need to have for the proper measurements at least 5 minutes HRV. So that's the standard.
And this is done in the clinic with special instruments. This is
the patient comes. The patient comes, and basically it's within the clinic as a session. Within the diagnosis, and the patient is gonna just give you relaxation. So the patient is going to show how they can relax, and they can relax at that moment what we have. So we need to take the baseline of the measurements.
And they should not take any coffee, tea, any stimulants,
that would
alcohol.
be the ideals and so on. But many of them are on some medication, so we know if they have beta blockers or any kind of medications regarding any kind of cardiovascular problems. If they are having basically any kind of palpitations, panic attacks, and so on, usually they're already seen a cardiologist. But cardiologists are going to see the technicality of the heart. So it's very good, very important that the heart is, healthy. And then we're going to see the heart from the autonomic perspectives, especially the autonomic nervous system. And that's the most important because in many I would say the rates of the palpitations and so on, we see that differently than the cardiologists. For cardiologists, maybe even heart rate 100, 110, it's okay. But in my eyes, it's very high anxiety already.
Right.
So, for example, we have lots of cases. If somebody would have this kind of, we see this kind of like graph right here, and there is no coherence in any kind of inhale and exhale, you can see. So basically, this person, would have very much anxiety, and somehow, this person is also prone to, kind of like popcorn, sudden, explosions and so on, because you can see the spikes are very incoherent.
So wherever there are spikes, which means the control of the mind is also lost.
No, we need to understand that these spikes is created by some breathing which is coming from the thinking and so on, because the job was to relax. So that's, how somebody can relax means how somebody has clarity in the subconscious, right? And somebody can switch off, So I always say, if you would like to relax, all right, you need to have a credit. You have credit card, right?
Yes.
So for credit card, you need to have money. So you need to work for the money, but you want to relax, you need to have credit of your thoughts, of your positive thoughts, especially for the meditations, for example, right? So when you have a credit of positive thoughts, then you can relax because that's, your thoughts, you you gather and so on goes through your mind. And especially when you want to switch off, if you don't have any sensory thinking and any kind of disturbances and so on, sometimes it's very difficult.
Yeah, most
because
people...
that's, how the, popcorn comes, unresolved problems, any kind of images and so on in the past, and any kind of situations which could be difficult and not really, addressed in that moment. Right?
And this is a very common problem right now. People are not sleeping. There's lots of stress. People overthinking, cannot control their panic attacks, anxieties. So this is what we will find, very erratic record, lots of sympathetic access. And then the next question comes is, HRV is also a number, right? It is like, so for example, my HRV stays anywhere from 60 to 70 milliseconds, what we at least get it from the watches. So is there a number also which comes in?
Yes. So basically for people who have these watches, so they need to be looking for the index of what is called the SDNN, or they're going to have the HRV. So everything about, let's just say, 50 should be okay. If it's getting close to the 30, all right, it's getting, at the age of, let's just say, fatigue. Athletes usually would have variability around 100 and even above. So that's very good. And that depends, on many factors. If the variability was taken in the morning or evening, or it's for the female and male, or it's basically athlete and non-athlete, right? So, or the age, of course, it's the huge factor, So everybody needs to get the monitoring and monitor it throughout the days and so on, especially before the sleep, after the sleep. And then basically they need to get some, outcomes, and that depends on the apps they have.
So for example, if I measure before sleep every single day for 7 days, and then I measure it every single day waking up, so do I need to have the mean of those 7 days to get that number?
So the watches gives you, or basically you're gonna sit on the iPhone or any kind of phone, right, which is linked to the any kind of measurements, Whoop or Polar, and you're gonna see it in the graph. So you see basically your sleep quality, but also the HRV which you accumulate during the sleep, and how is it before and after. Obviously, after the sleep, you wanna have very high variability. That's the goal. So, and that's beautiful monitoring.
So in case I get up in the morning and my heart rate variability is not high, which means I am going to be fatigued, I'm going to be super tired, I won't be prepared, my sympathetic axis is not there. So it's kind of not helping me.
There was some problem, because your sleep should increase the variability. Sleeping, good nutrition, physical exercises are basically the way how we're going to increase the variability. But what I found the most important is the breathing. Because breathing you can very easily imprint to the system, which basically this is a goal of our life, to develop the mindfulness. As I said, with your inner environment, which is only just in your control, you go to different environments during the day. You are in the work environment, you are in the home, you are in the sport environment. So every environment is going to give you different energy. So different pressure in some way to perform. So today people, for example, need to go to work 8 hours in the work, so they need to work very hard and so on to get the money from their account to the single account. So basically this is not easy to perform. So it's lots of energy consumption, right, in terms of the work, 8 hours. And then basically we can be dealing with lots of traffic, for example. Right. One of the example is like many of us, basically we have experience to get into the very heavy traffics in Dubai, right? The traffic may be representing the outside environment. And we are, the only thing what we can do is to just accept the outside environment, but in the way that we are accepting it in a positive way. So the breathing exercises can be performed in the way that we are not burning this variability towards the day. So we are not going to be getting nervous even before the work starts and so on, because really the traffic we cannot change. The way only we can change is our way, how to accept the situations.
Beautiful. You know, I was speaking to a youngster and I said that we get to learn how to study and how to do mathematics and how to do physics and all, but nobody teaches us how to breathe.
Yeah.
And all the people are right now shallow breathers and they don't use the biggest muscle of the breathing, which is your diaphragm, right? So tell us what really, when you say people have to learn to breathe, first of all, consciously, I think you use the word conscious breathing, mindful breathing. So what is the ideal way to breathe and how do they know that they are breathing well?
Yeah. Look, with this breathing, we need to be a little careful, because if I have a patient, so every, outcome what we have needs to be considered. And as I said, it's very important to see if the patient is in the sympathetic or parasympathetic. Because for the sympathetic patients, we need to use more calming breathing exercises. On the contrary, with the parasympathetic, uplifting a little bit. So we know when we inhale, the heart rate goes up. But when we hold the breath after inhale, the heart rate continues to go up. And then when we exhale, the heart rate goes down. And when we hold the breath after exhale, the heart rate has tendencies to go down. So every breathing pattern gives you different variability and different energy level.
And that is the beauty of the pranayam, what is
Yes.
being talked about. So every single pranayam would have an influence on the HRV.
Pranayama we consider mostly the nostril breathing, but I'm starting with very simple breathing exercises which can, the patients will be alternating two breathing patterns. Let's just say in general, and that's everybody can do. You can do very simple breathing in which you're going to inhale 3, all right, with your nose. Inhale, it's always with the nose. Inhale to the belly region. We know it's very important. We are talking about the vagus nerve, right? So we need to hook the vagus nerve, which is wandering nerve. And that's the first important thing, to engage this vagus nerve, And that's, only just when you're going to start breathing to the belly. And so we inhale for 3, hold 2, exhale 6 seconds, and hold 2. So the exhale is usually done with the...
We'll just go a little
with the
slow
mouth.
so that we can explain. What is there is 3 inhale, 3 seconds.
3 seconds inhale.
But with the belly, because once you don't include your belly, you're not hitting the vagus nerve, and vagus nerve is the longest nerve, which is also equivalent to your parasympathetic system. So that's why we have to inhale, which is breathe in deep enough, 3 seconds, and then hold for 2.
Hold 2 seconds,
Yes.
and then you exhale 6 seconds. Okay? So first we are training to be exhaling, with the mouth. I found that when you exhale with the mouth, for the beginners, the heart rate goes quicker down. It's more natural for the patients to. So our goal is to train the cells to have basically something what we imprint to the system. When you activate this breathing pattern in the daily situations, the cells recognize, he would like to relax, and they're going to bring you there. But if somebody is not breathing and so on, the cells don't know what to do in any kind of situations.
So
we're
can
going
we
to
say-
explain this in the more details.
So can we say it is like we can program our mind through the breath? So the moment you're changing the breathing, you're changing the way your mind is operating.
Obviously, because then once you have a good awareness about your breathing, then it's much easier to switch the awareness about your thoughts. So any exhale phase, basically, it's very important. This is the most important of anything. Hypnotherapy, you need to, calm down the patients, and somebody is going to be embedding the new thoughts into the subconscious, right? We don't need to see the hypnotherapist, or it's not handy. We need to do this by ourselves. And especially during the exhale phase, it's important that you have not just, the exhale itself, but you're going to have also certain what we call the positive affirmations, So positive affirmation in the way that basically when you're exhaling, the time between each pulses are spreading. And this is very, significant, how to embed new images or new schemas into the subconscious. So for example, when you inhale for 3, to the belly, hold 2, exhale 6, you need to have certain, positive affirmations as you inwardly repeating. So when you inwardly repeating something, you create these images, and you creating new images into your subconscious.
So I need to imagine what I want to achieve, let's say, for example, in the manifestation, what we say, during the exhalation or during the inhalation?
No, during the exhalation.
During
So the inhale basically
prepares you.
Prepares you, and exhale, and manage everything. Everything will be good, and so on.
Okay.
It's said, you can do something with the current test or in the future, but anyhow, it must be something what is very positive. Some, basically models are also preferring any kind of mantras you have during the exhale phase and so on, but you need to believe it. It must be something positive. It must be something, what is going to derail or basically switch off, revert these negative thoughts. You cannot be exhaling like, oh my goodness, what I'm going to do, and so on.
Yeah, I like that.
So
I'm worried.
How it's going to be changing? Because we are feeding the subconscious. We need to understand that whatever we are creating, it stays somehow with the subconscious, and it comes later on. So in the critical situations, many times happen we forget to breathe. Yes. And as we see that we are not good enough and so on, so we are caught up in any kind of situation. We didn't pass the test because usually, the situations are repeating for us, right? And in that form,
we call it the patterns.
Yeah, the patterns are there. Yeah. So that's very important that we realize, it's here again and so on. For example, somebody is doing presentations. Yeah, that's what I see, a huge, thing. Yeah, and this is the thing when you're going to be presenting, let's just say, on the Friday morning, and you're going to be rehearsing, let's just say, on the Monday. But if you're rehearsing in the way that you're going to be feeling, oh my goodness, how I'm going to be, and so on, you are basically embedding the negative thoughts, which at the time of the presentations may come on the surface. In that case, the breathing is not going to be so efficient. Because the subconscious needs to go out, that needs to go out, and sometimes the panic attacks and so on are helping us to release this kind of basically traumas what we have from the subconscious, and that's we are learning through this. So any traumatic situation is, in other words, it's a learning. We are learning how to basically manage this, how to get out from the patterns which are repeating for us. So as we're going to be training, for example, a breathing pattern 3-2-6-2 for 5 minutes, then we can change it for more meditative pattern like 3-3-3, 3 inhale nose, 3 exhale nose, and 3 hold. So that's going to be more meditative, which basically we activate deeper parasympathetic. So this 3-2-6-2.
In fact, we had done some experiment on Hanuman Chalisa, which is one of the mantras, where it essentially is like a box breathing, 4, 4, 4, 4. So you inhale 4, you hold 4, you exhale 4, and you exhale 4, hold,
Very good, yeah. But sometimes, the people may have problem holding it maybe in the 4. Well, for example, we consider just the Vedic knowledge is like the Soham mantra, That's the meditative mantra when you have 2 seconds maybe inhale, 2 seconds exhale. Because for the meditations, we don't need to have big variability. In fact, we need to have lower variability, but, deep parasympathetic,
Yes.
Which is engaging mostly.
The quietness.
Yes, the quietness. So every breathing has some purpose,
Wow.
So it's just not, it's really science. It's really science, So therefore, when we imprint this to the system, for example, somebody is doing this, 10 minutes in the morning, 20 minutes in the morning, and then the evening and so on, then basically we go to the next level. We are trying to be breathing throughout the day, basically with our nose only. So the 6 seconds exhale you are doing with the nose, so nobody can see that, all right? So that's the very important. You can do this anytime. So you're walking and you do this breathing
So you do
consciously.
basically consciously the 3-2-6-2, whenever you have time during the
Yes.
day. So you
Yes.
already completed the 5 minutes of the practice in the morning consciously. You sat with it.
5 minutes minimum. 10 minutes would be
10
ideal.
minutes
Yeah,
is
10
ideal.
minutes,
So
yeah.
10 minutes
Yeah.
in the morning and then 10 minutes in the evening as well. So that's an ideal
And that
breath.
would be even, very
So
good, right?
if
So
you
when
want
somebody practice in the evening, yeah.
if you want health, if you want to be free from all the diseases, at least minimum what you suggest is 10 minutes
10
of
minutes,
investment
10
in the
minutes, yeah.
morning and 10 minutes of investment in
Yeah.
the evening. But also during the day when you are sitting, you just have to be conscious that you do the 3-2-6-2, kind of
But you
breathing.
can do this 3 to 6 to any time, all right? So that means you are on the computer, you're doing this, you're driving the car, you're doing this, and so on. You can do this basically later, as I said, with the exhale with the nose, yeah? Because this is something, what is more advanced, all right, as we're exhaling with the nose. And so you're doing this breathing all the time, and so nobody can recognize it. Somebody comes to you, you're out, yes, 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 and you are in and out, in and
Beautiful.
out. That's what you are learning,
Yeah,
right?
in fact,
in and out.
Yes, in fact, that reminds me that I had a very turmoil phase, of emotional, lots of trauma happened, and I was not able to come out of that. And somehow, I got hold of Ujjayi breathing, and that's one of my favorite breathing. When you breathe through the palate, the Ujjayi,
Yeah.
and somehow, when I would answer my emails, I would be automatically doing that. When I'm driving, I'm doing the Ujjayi breathing, and believe me, it changed my life. It was just a absolute change in the autonomic nervous system. The way I would respond to a certain situation changed completely. My reactions came down. So I think everybody must be aware about what their breathing patterns are and then how it influences their entire reality. I think breath can change the reality.
And that's the thing, because now, thanks to the technology what we have, right, we can actually kind of like be doing the research in these areas and confirming, for example, the Vedic,
Yes.
traditions of the knowledge, right, now with the modern scientific views.
Absolutely.
Sympathetic, parasympathetic. For example, you have Ayurvedic, right? And lots of Ayurvedic doctors. Sympathetic is Pitta. Kapha is parasympathetic, and so on. So it was there centuries back, when somebody was doing diagnosis by the pulse reading and so on. Now it's the same with the HRV. We
True.
have sympathetic,
That's right.
parasympathetic. So we have the technologies which confirming this.
And the beauty is that also relates to the QEEG and the brain scans, because we do a lot of quantitative electroencephalogram. We did one with you where you did a special Kriya and also the Bastrika. But see, what we have seen is when people are in the sympathetic state, very fast beating heart rates, the HRV is all erratic, there is no coherence, then obviously the beta, which is the fastest brain wave, is also very, very high. They cannot produce alpha. The moment they close eyes, what you should have a nice, beautiful 7 to 8 hertz alpha, they just cannot. So we need to train them now, essentially. And the best way I feel is the biofeedback, which is you train your heart rate variability and hence you train them to calm down. So tell us some of the ways in which you train a patient when they work with you for this purpose.
So this is the thing that basically, the HRV takes only just 10 minutes. We know the EEG is very difficult to put the electrodes and so on. So within 10 minutes, we have basically a beautiful data in which we objectively see the stress. And especially, as I said at the beginning, to see the sympathetic and parasympathetic. Now, we need to understand that we know basically that we are functioning, one of our hemispheres is more dominant, yes, in certain way. And in every, basically activity, sympathetic or parasympathetic, there is some advantage and disadvantage. So people who are having, very high sympathetic, they can be very good, for example, in terms of decision making, logical things, basically executing. They are very good salespeople. Yeah, so they basically don't have social phobia because they may be very proactive and so on. They don't have any kind of fears to meet some people and so on. Yeah, disadvantage of the sympathetic is stubbornness, all right? Its inability to relax, switch off, and so on. Very high anxiety, which basically it can get detrimental later on, and so on, right? Depends of the values of the and goals of this, participant or the patient.
So I presume that people who are attention deficit, and we have now increased cases of ADD, they would be having a very high HRV, very high heart rate
They will
variability?
be mostly in the sympathetic, 100%. I see ADHD patients in the sympathetic.
Right.
And that means, all right, when I see ADHD patient, first what called me is they breathe through the mouth. You know,
Right.
especially children. Imagine teenagers, yeah? Inhaling with the mouth basically hyperventilates that. Yeah?
Right.
So that's, you know, they are having lots of energy. They have lots of energy, but everything is more kind of like bubbling within them, yeah, in the sympathetic. So they need to know how to change the breathing to the nose, which calms them down, and basically we have beautiful results doing this, yeah.
So
with
we
the ADHD.
train them. Basically, we teach them how to breathe, you know?
Everything is about the training, what I said, yeah. So basically, as we imprint the exercises into the system and they have it, you know, doesn't matter where they go, the variability goes with them. And when we do the variability here, it's in sitting, but when you're standing, it's uplifted a little bit, but it goes with you. And basically, your life becomes easier.
Right.
Because you're going to have the conscious breathing, and with the conscious breathing also enhance your cognitive ability. That means, you know, you're going to have better view of your thoughts, which are coming from the past, or worries about the future, or any kind of images which you need to deal with or revert, especially to basically not developing fears, negative imaginations.
But my question is that one time of assessment, 10 minutes, is that enough? Because you just see a patient for one time, you get a 10 minutes, because a lot of people ask me the same question about the brain. So we have something called the Neuroscience system. It has 17 different parameters, and very quickly nowadays our EEG systems have also evolved, you know, so we get the data within 15, 20 minutes. And generally what happens with us is that data is quite good enough to showcase what a few months of their cognitive health has been. Is that the same with the HRV?
It's the same. 10
Okay.
minutes is enough. That's what I said. I want to see if the person is more in the sympathetic, parasympathetic, but also what kind of stress would somebody have. Can I show you some, you know, results so we can see better? So here we have a beautiful coherence. Yeah?
Wow, yes.
So this would be somebody in the parasympathetic, you know, beautiful,
Lovely.
you know, coherence, one close to each other.
Beautiful.
So basically, it's very high percentage of the resemblance, and the variability what we see is more than 100. So this would be somebody who would be practicing very, you know, consistently and beautifully in the way that we can see the results.
We saw this with gratitude, you know, when we introduced, we work with Hariom Smiles and their tools, and Monica Singleji, we had a special gratitude practice. And when people were doing that, there would be a perfect, you know, synchronous, beautiful coherence coming up.
Because the coherence of the heart reflect immediately the coherence of the brain, right? So that's, you know, how it is connected, you know. So, and it's a system basically which works like, you know, something what is really, you know, unique, something what basically is very much connected
I mean, I'm
to
just
each other.
fascinated, you know, how the entire human mechanism and the brain mechanism and the breath mechanism works, right?
How it works.
Yeah, beautiful.
This will be, for example of fatigue. You see the almost flat line.
Very small
Very small.
line.
You know, this
and
patient would
what
really
would be the
suffer,
number, Doc,
yeah.
for that? What would
For the HRV, that would be 21,
Okay.
21.2.
And what age
so
are we
imagine
looking at?
This patient, right, when it comes, because let's just say I will take this baseline like this, right? He comes first time and so on. See, the advantage of the HRV is this, that I cannot lie to patient, and patient cannot lie to me.
Right.
I guarantee you, if he does, you know, the breathing exercises on daily basis, very diligently and so on, there is going to be a improvement. Yeah. So next time when he comes, we do another 5-10 minutes, all right? Then we need to see the difference. So naturally, the spikes will be created and so on, and maybe not really coherent and perfect. That's not the goal. But he needs to also feel subjectively,
Yes,
you know, better.
improvement.
So a little lighter and so on. Because I tell you something, when we have a patient in the psychotherapy, I'm more successful if the patient increase the energy and HRV during certain time frame. Because when you don't have energy, the last thing what is going to be to working on your positive thoughts. This person has a problem to get up in the morning and so on, he's in the old patterns and so on. So basically, as we increase the variability, everything goes, within. What was the first, the hen or the egg? See how it is? So it's very much connected. So basically, by slowly embedding positiveness and so on, motivational factor, new goals and so on, exercises, physical exercises and so on, this variability grows, naturally the mindfulness grows, awareness and so on. And then, basically we can get beautiful results.
We have seen with one of our techniques, we call it the movers. So meditation, oxygenation, visualization, exercise, reading something affirmative or positive, and scribing and writing what's negative. And this has helped the patients a lot. If they do 5 minutes each, just 25 minutes and their life is changed. And I'm very sure that if we follow this up, the HRV would be something which would be impacted, if they follow this every single day.
We can do that. Basically, they can do something what they like, right? So liking also increases the HRV, of course. Yeah, this is somebody who was after heart operation. Yeah, so we can see the variability is like 13.4.
Very low.
And very low. So that means it's like flat line.
Right.
So that means if this variability doesn't go up over the time, within few weeks and month and so on, this patient is not going to be living a long time.
Right.
So unfortunately, we can see through the variability also the longevity. So the longevity
that's a very interesting point.
SDN.
So you would see the longevity of the physical longevity, which is your chronological age versus your biological age. I think you can prolong your biological age if you work on the HRV. That's my feeling. I'm sure there will be results for that.
The breathings can prolong this, as long as the heart is healthy and so on. The breathing is gonna boosting this, basically dynamo.
The holding has also been shown to improve the neurogenesis, which means the new brain cells growth. So people who have neurodegenerative conditions, Parkinson's, I had a patient of ALS, amyotrophic lateral sclerosis today. So kumbhak, which we call as breath holding.
Holding the breath after inhale and exhale. So one of the major things, because as I said, when you hold after inhale, the heart rate goes up. When you hold after exhale, the heart rate goes down. And that's how we're going to stretch the variability.
Higher variability.
If I can explain about this, please remind me a little later. What I wanted to say is about this longevity, that it reflects, the variability is actually, it's a predictor. Let me tell you something. So one day in the morning, actually, there was a Christmas time in my country. I came, when you come from Dubai to the cold, you know how it is. You're going to get always something. So my heart rate is usually resting between 55 and 65.
Oh, you have an athlete heart rate, unlike me.
But I can see, the aging already. I can see. But anyhow, so I was measuring, like every morning I'm doing 1 hour breathing exercises, 25 minutes pranayam, baseline Bastrika, left nostril, right nostril, Anulona Vilona with holding, and then Kriya exercises. Kriya what we did on the measurement, right?
Yes.
So after I finished and so on, I checked my heart rate was 80. 80, how it can possible and so on. I didn't feel bad or something, but variability was a little low, but the heart rate was 80. It should be between 55, 65, right? So that was 8 o'clock morning, let's just say, and I was going towards the day, and suddenly, maybe 4 or 5 p.m., I got really kind of like shaking, high temperatures and so on. So basically, the variability predicted some inflammations in the system, which was dormanted.
Beautiful.
How the cells are fighting, and so on. Basically, they're increasing the heart rate, So that means, basically that I got the fever and so on later on, which fortunately took 3 hours, and then it just disappeared. But it was a predictor in the morning, So the variability is very accurate, and when you're going to monitor daily, you can see, how is the energy level when you wake up and so on. I have many patients who are telling me that, they monitor if they, for example, have, certain evening and they were drinking, the variability is actually, get lower as you drink, and the same variability, low variability will be in the morning. So alcohol, smoking, everything like this, all right, it's going to really impact the variability.
So this is extremely important to understand, that alcohol, smoking, any kind of toxic substances is going to keep the heart rate variability low, which is not good, which means it is not healthy, and hence we should have as much as possible the variability. I was just looking into that thing because we are showing the screen to the audience as well. There is something called the time domain and the frequency domain. Would you quickly explain?
Basically, if somebody likes to go deeper, they can buy more sophisticated measurements than on the apps, because the apps don't give you, basically the graphs, yeah,
Right.
or graphs which are basically graphs for every second, yeah. So for the variability, we have what we call the time domain. When we see the here the mean heart rate, the mean RR interval, that means the timing between the pulses, yeah.
The beat to beat interval.
Yeah, beat to beat. So everything around 1,000 milliseconds, all right. So should be in parasympathetic, yeah. So the time between the pulses. So our goal is to excel in the way that we're making the gaps between the pulses. So 1,000 milliseconds, it's basically 1 second, yeah. So gap between each pulse, 1 second, would guarantee parasympathetic. It can be also in the 900 milliseconds, what I see, yeah. And then we're going to see the SDNN and RMSSD, which is basically in the time domain reflections of the parasympathetic. So, but the most important is the SDNN, which may not be in the apps, but it's like HRV. So basically, as I said, everything below 30 is not good. Needs to be kind of like checked. Now, the frequency domain, we have total power, which is basically the SDNN, and it's a beautifully divided. Let's just say you have energy. Energy in the aggressiveness, energy like spiritual energy, right? So everywhere you go, you have different energy. You go football game, you have different energy, atmosphere, yeah? You go to the concert, you have different energy, yeah? So, but some energies, are mostly, helping us, and sometimes, we are impacted by them. So these frequency domains, divides this, that we have very low frequency, which is considered to be as a cognitive stress. Like, for example, when we do -7 tests, any kind of arithmetic test, and so on. And then we have the low frequency, which is the sympathetic, and high frequency, which is the parasympathetic. So when the patient comes first time, I see, how much sympathetic, parasympathetic is there. And I see tendencies. Maybe, obviously, the patient may be nervous first time and so on, yeah? Then I can check many things. That depends, what is the goal. I see, the reference, for example, from doctors, psychiatrists, and so on. So I already have some information. But let's just say, we have, we're going to do some cognitive testing, usually arithmetic tests, right? You're going to give them just very simple tests, like -7 tests.
100 minus 7, simply, yeah.
Yeah, well, let's just say 1,000, yeah?
Okay.
So 1,000 minus 7, it's 993. So you're going to tell him he's not ready for that, yeah? So you're going to tell him, can you count down -7 out of 1,000? And then you're going to see.
Yeah,
So
the heart rate will increase.
Heart rate is going to increase and so on, right? In some patients not, right? Some patients are going to really, count down 993.
And which is good, which is
very good. And so, but that's what you're going to see, yeah? So when you see the heart rate goes up and so on, right? This is not that they are bad in the math, right? You see lots of subconscious tendencies, because they're going to say, oh, I don't like the math, and so on. And they actually switch the concentrations from the counting to the kind of like the subconscious impurity, what I would say.
The problems which they are harboring
coming
inside.
on the surface. That means the fear. They're going to see, because many of them are perfectionists. Oh my goodness, I don't want to look stupid. And so this is like within the 1 or 2 seconds, all these, volcano of this kind of intrusive thoughts are coming, which basically increases the heart rate. Because the cells is the same, like I would have the temperature, right? within the system. They recognize these kind of like threats or the fears, fearful thoughts and so on, what we have in the subconscious as a threat.
Right.
So the system actually likes to protecting you. Therefore, the heart rate increases, shooting these, adrenalines or, other hormones to protect this.
Okay.
Because the subconscious fear.
It wants to make it comfortable. It wants to feel protected, and
the
so
system evaluates this as
Beautiful.
a threat because it's coming. So it can be like, as I said, right, somebody would have the avoidance we see and so on. But what we see in these, 5-10 seconds, you're gonna see in the whole picture.
Wow.
The same pattern is going to happen when somebody has, basically some presentations or any time. So avoidance, And I found, people in the parasympathetic are very sensitive, and the palpitations are happening especially for them. So the palpitations happens mostly in the parasympathetic, in the sum axis. Where we have the sympathetic adrenal medullary. So that's the axis which actually activates the heart rate, panic attacks, heart rate palpitations, and panic attacks.
Wow, that's very.
This is actually one example what I using as far as the panic attacks. Yeah. So you can see here
big,
it's a
nice
case study.
rise.
Right? Yeah. So this was a patient I measured, and I told her we're gonna do just 5 minutes measurements. So she was sitting like you, and she was 35 years old, American, came to Dubai, just 3 months here. And I always say, just relax. Your job is to relax, nothing else. So we can see she starts in the parasympathetic, not bad, and so on. But then suddenly her average was 60, going up and so on, up and up to 120.
So there was a sudden spike that
sudden
we see.
Spikes, and that's what we can see the panic attack, right? Now what's happened? She wasn't physically moving because the heart rate goes up also when you move your hands and some body and so on, right? Also when you're swallowing, for example, the heart rate goes up. But in her case, she was sitting. So the way how she was thinking was pushing the heart rate up. About 60 beeps, imagine.
Wow,
right?
that's huge.
That's huge.
Yeah.
So,
and what was she
and
thinking
then suddenly
about?
you can see it was going down. Yeah. But in this case, it was actually much easier job because I asked her, so do you know what was this trigger right here? And she said, yes, I know. So in some cases we can have already the core of the problem, but in some cases we don't know because even the patients don't know when they think and so on that it go what they were thinking and so they don't have this kind of awareness. But in her case, basically the heart rate was increasing. So I asked her, so do you know what you were thinking? And she said, yes, I know. I know what is the problem. Very good. So that's going to speed up all the process, And she said, yes, I was thinking about my ex-husband. So imagine the ex-husband, all right, it wasn't in the room, He was thousands of kilometers in US.
But just that little image of the person and...
Whatever way she imagined him, whatever the face, his face, all right, basically the cells recognize this as a threat. So the cells want to protecting you against, any kind of unresolved problems you have, and basically the threats, what we have coming from the past. And that's, in this case, we already know that's the ex-husband face. That means she has the anger. Because he divorced her, apparently, that was a bad. He found out somebody else. But make it very short, basically, we already know what is the trigger. So again, the cells don't recognize. If you see the stress by your physical eyes or you imagining the things.
So even just bringing the image in the mind is going to be like a response.
The same response. Right, look, it was going to 120. So this is kind of like, let's just say what we can call it like black cloud, which how much negative correspondence in the endocrine system it can create.
Yeah, so I'm just thinking loud that imagine the number of the fears that we harbor in the subconscious, all the negative beliefs that we have, and how often our cells gets threatened, and every time they trigger. So every time we remain in sort of a chronic, persistent stress.
Pattern of the subconscious.
Wow.
The patterns are repeating, And when you think about this, anything what happened in the past, and they are playing for us as a movies, right? There are movies, just goes to the screen. The reels are playing for us,
So
But let me just finish this
sure.
we can have some wisdom from this. So we knew the core of the problem is the ex-husband. So he was thousands of kilometers away, and the cells recognizes as a threat. So therefore, the palpitations happens. What we need to do in order to wipe this out from our subconscious? What do we need to do?
So I think we need to bring the HRV down first of all. That's what I presume. That's what I will, because that will make her calm. That'll make her relaxed.
But would that be enough?
No, because it'll come back again.
Yeah. So yes. So the breathing would help, right? So inhale and exhale, right? With the mindfulness doing this during these kind of episodes, because whatever happens here, it's gonna repeat.
And it is basically our limbic system or the emotional regulatory system which is malfunctioned, right? So that's why all the threats would always be in terms of fear, flight, fight, or freeze, So it is, and what we need to do, I mean, technically as a neurologist, we need to build the prefrontal cortex to support and regulate that emotion.
To have these more visions or basically the clarity, yes? And that creates the impact for the amygdala later on, right?
Yes.
So in this case, right, we know the triggers. So basically it was easier work because I'm going to make it short, So the therapy was concentrating basically to make a peace with that, right? So in other words, in every religion we have the forgiveness.
Beautiful.
So, and now scientifically we can prove how the forgiveness works.
Lovely.
Somebody or the Westerner world considers this forgiveness as a weakness. But if you forgive somebody, you're helping somebody.
Very
so
true.
the therapy was concentrating to make a peace with that. So that means when she imagined this phase of her ex-husband, whatever the phase is and so on, she needs to make a peace with that. That means she needs to evaluate the whole situation differently. Not the way how basically she was suffering, but make a peace with that in the terms, so accepting this, okay? Actually, it was good that it happened because there was clear evidence he didn't love you. And
So, Doc, just help me explain, because a lot of people are going to get benefited from this, and a lot of people can practice this very simply at home. Forgiveness or gratitude is not difficult at all. So in this case, should I think and bless him, like, whatever he did?
That would be yes. You are on the good track, Dr. Sweta, because later on, we need to change, romantic loves, all right, are very tricky, because at the same way, imagine you are giving love to somebody, all right? So that means your dopamine reward system or pathways are connected to this person. When you imagine you're giving the love, you're a target, everything goes well, you are so happy because you have oxytocin, dopamine, and so on, right? But in these relationships, this is something also what we call the depending variable. It's attachment, So if the person doesn't behave as you want and so on, you are going to be lowering this dopamine, oxytocin later on, and then you feel more kind of like depressed because you used to have high dopamine and so on, and suddenly you are disappointed. So in the romantic relationships, a little selfish because you want to have this person for yourself. Even you will be so happy that you have somebody and so on, the duality can appear that you may get some sudden fear, what if I'm going to lose it?
Beautiful.
Yeah.
Yes.
And so the duality is there. As you're going to enjoy something, I don't know why is it, don't ask me. We need to also consider the opposite, And that's, the painful side of these romantic
but-
relationships that somehow, the romantic relationships are teaching us to go to the ability to give the unconditional love. And I will explain to this.
No, before you explain that, this is something very interesting that you have brought up. Why is the brain not able to accept non-duality? I mean, everything is going to be dual. If I have a pain, I may have relief, If I may have love, I may have hate.
But that's what we're learning to see. Everything what makes you happy, everything you are attached has duality. Once you enjoy something, there will be some pain.
Right.
Yeah, so that's how it is. This is a little
Philosophical.
but it's the reality.
Yes, very true.
Especially we are the most hurt in the relationships. Either romantic relationship or business relationship, we are most hurt during the relationship. And therefore people are very close now, being careful and so on, no social, because even people, mostly people in the parasympathetic, which I consider more sensitive, very intuitive and so on, they have social phobias. Yeah, they have somehow the ability, maybe they read the other people's minds better than the people in the left hemisphere, and they are afraid to be disappointed. And so this kind of social phobias we see nowadays, it's like you are not meeting the person in the face, you're gonna send the message and so on, the social, but it's a different when you're gonna see somebody in the reality. True. And you see the energy.
Very true.
So in this case, as the therapy continued, so we actually were doing this kind of like exposure therapy. So she was imagining him, and somehow, right, in the way to give him this more unconditional love. All the best. Thank you very much. I wish you all the best. Have your life you're choosing, but also put some, like hope in the future. She can also remarry somebody she deserves. Unfortunately, she didn't have any children, so she's gonna start something new. She's gonna have somebody she deserves for the future.
Beautiful.
So you're gonna put a little hope in the future.
Lovely.
But the most important is this unconditional love, because when you give the unconditional love, you cut the feelings.
Yeah.
So what is the difference between the romantic and unconditional? Unconditional is more the spiritual love. You're gonna give this love, and this is something what people understand differently. Yeah, it's not the romantic love. You just wish everybody the best.
True.
You need to develop it. You need to be working on this, develop it. It's like the mother gives the love to the child. Even if the child misbehaves, bites her or anything, you're going to have always, some beautiful feelings. True. Or not changeable feelings.
I think you're talking about exactly my life story, until and unless I learn to forgive, to have the hope that, yes, my childhood friend for 25 years long is no more with me, and Ho'oponopo, what we call the Hawaiian prayer, the three things that helped me was breathing well, getting aware that everything is not non-dual, so you have to accept the reality that this is what the reality is, and then forgive and keep the hope that whatever is happening for the best.
Yes, the unconditional love has one condition.
I like that. Unconditional love
Yeah.
has one condition. Yes.
When you
please.
wish everybody the best, right? You must not have any expectations.
Beautiful.
You don't expect anything back.
Beautiful.
If you expect something back, you are out. Because expectations, creates disappointments.
Yeah.
You're expecting. It's create a little anxiety.
In Hindi, there's a beautiful phrase, apeksha is expectation, is dukh ki suraksha, which means you guarantee sadness once you have expectation.
But it's not easy, right?
Very true.
We wishing the other people good. You can pray, you can wish, and so on. But yes, there may be a little expectations, because we also expecting love from somebody.
Yes.
Yeah. So that's how it is.
So can the prayer also change the coherence if somebody is praying irrespective
mantras,
of
yeah.
the
So
mantras?
yes, for example, yes. So doesn't matter religions. It's Muslims or Hindu. So with the exhale phase, right, you can do beautiful Muslim prayer or Hindu prayer. Yeah, but you need to believe in this. Yeah,
Right.
so that's very important. So in this case, doesn't happen the change or the unconditional love, techniques and so on overnight.
It takes
So
time.
what's happening is when the husband comes next time, the cells don't recognize it as us the threat, all right? So it's going to be less and less because you're going to change the stance towards this image. It's just the image. So later on, it's going to be less and less as it naturally will fade out. And the outcome, it's very unpredictable because it can take, few weeks, even months. And in some cases, much quicker.
Wow.
So that depends how is the intelligence of the patients, how is the capacity, how is the hypnotability of the thoughts. That means the awareness of this. And, the training, the mechanism, because the Excels and so on are going to help. But again, that's not enough. Breathing is not enough. We need to do the cognitive task, right? Because
reframing, what we call it.
Reframing. So
Yes.
then basically there won't be necessarily the palpitations because the cells don't recognize the threat.
True.
Because your stance, your evaluation of this person change.
Right.
So therefore the unconditional love, you are wishing everybody the best. And that's basically in the meditations, which is the goal of the meditations. Learning from these, romantic relationships as we go up and down and so on, right, through the marriage and so on, activate this. Even in the young age, because then as we're going to give it aging, we're going to hit 50s, 60s or 70s, then for us it's going to be much easier to link into this and basically create something, what basically would be increasing our longevity. And also, basically it's a purpose of the life.
Very true.
Develop this, unconditional love in terms of the meditations and so on. So we're going to have a purpose later on. In romantic relationships, you cannot do much and so on. You cannot say, okay, you can do whatever you do. This is not working. It must be communication. So therefore, the partners needs to be compatible at the same level. Yeah.
Very true.
The physical attraction at the beginning, sometimes it's very puzzling and so on. But the long term shows,
In
the
fact,
values
they say
and so on.
it's just 18 months that the entire limbic system is with the reward mechanism, and then you hit the reality, and then.
And
but I want
that's how it
to
is.
I want to ask you two questions. The best breathing practice that you have seen, which has changed the HRV like magic, So is there any magical trick for breathing and which people can do it at home after learning the basics?
That's what I said, right? We need to stay in the safe zone. That's I'm teaching very nicely. 3 inhale with your nose,
two hold.
2 seconds hold, 6 exhale mouth, 2 seconds hold. We were gonna do 5 inhale exhale. It's roughly 1 minute, right? Then you're gonna change it for relaxing, like we can do 2 inhale nose, 2 exhale nose, 2 hold after exhale. So 2 holding after exhale is going to lower the heart rate.
Okay.
And that's the goal for the parasympathetic. Yeah. And then again, 1 minute you're going to do 3 to 6. So you alternate this breathing, right? Later, all right, you can also add more seconds, but see the Hoffman techniques and so on, right?
Yes. I think also the Huberman technique.
But somehow I would say, we need to be careful because holding the breath after inhale, 5, 7, 10 seconds and so on, right, can for some people can be detrimental because the subconscious is pushing. So holding the breath and so on goes deeper into the subconscious. So many things can come up on the surface, and if the people are not trained, they may have problem. They can feel, even high anxiety and so on in certain way because this holding after exhale basically is more to activate the sympathetic nervous system, withstand the coldness in the body or somewhere and so on, prepare you for the fight. But for some people, it not may be, suitable. It's like you go to yoga class, all right, and the teacher is going to do some breathing, all right, some breathing pattern. You have 20 students. But many of them are in the parasympathetic, many in the sympathetic. So they're going to experience this breathing pattern differently, 100%, all right? Some of them are going to be enjoying more or less.
Actually, you're right, because everybody is at a different baseline. So
exactly. So
there's no
therefore,
match.
the advantage of this variability, see the baseline and tailor this, breathing practice in control way, No experimenting. We need to be careful a little bit
Very
with
true.
this, right?
Very true.
So therefore, you know,
So a lot of people do pranayams in their homes, etc., and all, and which is a good thing. But then, I always say that the way in which you do the fast pranayams first, then the alternate nasal breathing, also called the anulom vilom, and then the slow ones. Do you think that is rational and logical?
slowly. Pranayams are not gonna hurt, all right? So basically, breathing with the left nostril, we know, activates mostly the right hemisphere. We did lots of studies
Yes,
about this.
yes.
Right nostril, left hemisphere. So it's boosting your mostly the cortical
prefrontal
region,
cortex, yes.
prefrontal cortex.
Yes.
And is it set in the right side of the prefrontal
Yes,
cortex, right?
yes.
So mostly in the right hemisphere, right?
Yes.
Especially breathing with the left nostril. But we cannot just breathe with the one nostril. It's like you will be working out with the one weight only, yeah?
Yeah.
So we need to have the balance because the communications between the hemispheres and the lateralization is always there. So you're boosting one, but it's communicate to the opposite and so on. So when you want to make good decision making, which is coming from the prefrontal cortex, basically you need to have a balance between the intuitive sides and the rational. So you know how much something is going to cause and so on, but intuitively you're going to see that if I'm going to like it and how it's going to be the feelings having this and so on, right? So both hemispheres, all right, we are trying to get in the peak, all right? We know we are oxygenate the brain, all right? So we know we are also activate the oxygenate hemoglobin into the system and so on. So there are lots of benefits.
It basically performs better,
Yeah.
So people who have been having these watches and all that, and just coming back to the practical points of it, if you see a very low dip, which means there is something going on. If there is a very low HRV, which means you are tired, you need to really rest, there's something not right because your energy levels are very low. And then if they see a lot of high HRV, which is much beyond what they normally see as an average, which means there's some stress, something which is bothering them, the sympathetic is very high and they need to recover and rest. So I think very simply, very, very easily, you can understand what is going on. But if you are aware, if you have learned all these basic fundamentals of what happens when you breathe in, what happens when you hold, then it will be very easy to connect with that HRV as a number. A lot of, youngsters come to me and say that, I've been monitoring, oh yes, they quickly get the data and then I ask them, but what sense are you making out of it, And that's when they fumble, they struggle. They just keep looking at the recovery. So it's not just the strain and the recovery that you look into, because that's how the graphs come in. But what is the pattern and how does it relate? I think what beautifully you said is to the life circumstances. What pattern is getting shifted with that HRV? What is going on behind the scenes in the subconscious, So being aware, I feel, is, I think, ABC. Being aware is the first step. Then comes your breathing and then possibly going to the conscious breathing, right?
Yeah. And that's what we are doing this, basically make our life much easier. Yeah. If you want to have muscles and so on, you need to go to gym. You need to exercise. You want to be good runner, you need to be training. You want to have better nervous system, all right? You want to be stronger, having stress resistance, you need to do breathing. There is no another way how to do this, yeah? The miracle doesn't happen, okay? So we need to be working on this. Yeah?
Very true, very
true. And we know everything what we do come back to us, all right? So in small pieces and so on, we're gonna basically receiving that and so on, all right? But it's not gonna happen over time. You need to be training. You need to sacrifice something, your time and so on. So 10 minutes, 20 minutes morning, it's not a lot time,
No, I think, Doc, it's an investment, You are investing for good energies. You are investing for clarity. You are investing for a well-working PFC. You are investing for, I think, settling out the situations. As you rightly mentioned in the start, you're not going to change the outside circumstances. That is out of our context, But what the inner, the stability, the inner peace, the inner wisdom that you have, that is through the investment.
And that's what we need to work on this. Yeah? We know how to do this. So, for example, I knew these things 30 years back, right, about this pranayama and so on, but nobody was able to explain me why we're doing this, what is the benefit of this, and so on. Thanks to the, the medical science, the basically instruments what we have, the gadgets and so on
Yes.
for monitoring and so
Absolutely.
on, we already now see lots of things which basically was confirmed many times in the history in this kind of like Vedic culture, you know.
Yes.
So basically this knowledge belongs to the humanity.
Yes.
And now we are trying to just confirm this and so on, and again spread it out to the humanity.
That's why
it.
that's why
That's
I
it.
like the word research. It was already searched, and now you are researching. Thousands and thousands of years back, the wisdom from the ancient people, the ancient, I think, even in the Indian traditions, Buddhist traditions, Tibetan traditions, you name it, everywhere, Chinese traditions, there's lots and lots of wisdom lying there. The modern science is trying to showcase and actually, beautiful graphs. I love each of your graph because every graph tells a story. There was a friend of mine who was telling me as I was saying that, I'm going to be talking to a professor who's doing work on HRV. And he said, I know a person who looks at an HRV and says, how much is the diabetes? Or what would be happening with the levels of hypertension, high blood pressure. So I was like, wow, if we have to treat people with neurodegenerative conditions, if we have to treat people with mental illness, if we have to even treat children, with ADD and a lot of other conditions, we have to be fundamentally looking at such data points, not difficult to get it, very easy to, work around it. And most importantly, I think what you said is the commitment, discipline,
everyday training, every day you're imprinting, you're doing something good for yourselves. And that's the thing, that if you're gonna have a patient and you're gonna explain this, then you're gonna motivate them to buy this watch and so on.
Yes.
Monitor yourself. There are lots of rings they can buy and so on. So many of my patients got hooked up with this, and they learn something and they just monitor. My job is to put them on the right path, explain them and so on. But how they gonna maintain? It's gonna be under their decisions.
Very true.
So they have the jewels, they have this basically knowledge, and how they're going to use it depends on them.
So I always tell my patients that it's a 50-50%, it's a teamwork. I do 50% for you, I show you all the data, you know what is happening inside, you learn the fundamentals and basic of it, but the 50% of the work is with you. Now last, before we go, let's ask him also about the parents who would be listening to this, and they may have young children. So what kind of breathing techniques should be incorporated in children's life, because their HRV is generally on the higher side.
So with the children, basically you're gonna monitor a little bit, how is the inhale, how is the exhale, and usually I insist that the child, if it's like maybe 12, 13 years old, comes also with the parents, because the parents are going to basically monitor it and checking and so on. And then sometimes parents are learning and it's bouncing from each other.
Yes.
Then the sister is going to learn, the siblings and so on,
True.
right? And basically the whole family is going to do these exercises. So it's very, straightforward, basically method, which is basically is nothing else. It's there. I see lots of, children are doing, for example, these exercises on the way to the school, in the cars and so on.
Okay,
better than nothing. And they're going to use it in the school, in the classroom and so on. So it's imprint to the system and they feel the benefits.
So do they do the same, 3-2-6-2?
It can be less and depends, but usually the exhale, maybe even a little, maybe 5 seconds and so on, depends on the capacity, how they can extend. Very simple, it's just very simple thing, but most important is to inhale to the belly. It doesn't have to be inflated like this, because if you inflating to the chest, it's nothing, it's just balloon. The magic is here,
right,
in the intestines.
The magic is right here, in the
right? So all the gut and so on, we know this is the magic spot for us.
And I think what you rightly mentioned is that because you breathe from the belly, that's how you activate the vagus. Otherwise, there's no question.
Vagus nerve, it's a wandering nerve and so on. We don't want to get the, vagus nerve, basically surgery. We can activate it, by ourselves. Yeah.
Wonderful.
In the way how to breathe and so on. Slowly it hooks. And when we have the parasympathetic, that's the vagus nerve. So that's basically the work. Yeah.
Beautiful, amazing. I hope you learned a lot from this particular podcast. Dr. Martin practices in Novomed, in Marina in Dubai. And what I love about him is he's very open to listening the ideas about mantras, about all the practices, the Vedic wisdom, which can also be integrated with it, and very thorough when it comes to reading the graph and then making sure what kind of practices, what kind of exercises. Now you have some work to do when you go home. I want you guys to know what's your average heart rate, what is your average breathing rate. Are you breathing appropriately from the diaphragm that we just spoke about? And when you imagine, visualize any kind of threat, anything that is happening in your life, as he beautifully mentioned, your cells are already preparing to fight. Are you able to catch them there and slowly bring the intensity down and remove those threats? And very simple forgiveness, unconditional love, making sure that, everything is not considered a threat by your brain, by your body, and eliminating the chronic stress. Making sure that every single data point is appropriately evaluated, and not forgetting the ancient, old human tradition of breathing right, and the modern way of just showing it how beautifully it can change your, not just the health, but relationships, your entire way in which you are operating, the way you will be going to your work, and the way how wealth and prosperity can also flow. This is the beauty of what I like about the science, that it's super easy to monitor because of the gadgets which have evolved. AI has made our life so easy. It's super easy to modulate, and neuromodulation, both from the central perspective, the peripheral perspective, and the breath, is like magic. So thank you so much for being with us, you guys, and thank you so much.
Thank you very much, Dr.
Martin,
for having me here. Thank you very much.
Thank you so much. Thank you, everybody. Do not forget to like, subscribe, and share. If you have any particular questions for Dr. Martin, please do write it in the comment section. We will come back to you with those questions. And as usual, please do write all what you feel about these shows and what kind of topics you want, because we want health, wealth, and happiness for all. So namaskar. Signing off, Dr. Sweta from the Limitless Brain Lab.